from a station working for you. This is WRTV News at 5:30, streaming now.
Now at 5:30, the city's cash-strapped housing agency may be spared from losing a prime piece of property. What's at stake and why one city leader is not stepping down? Lindsay.
Topping today's lineup, as we wait for a COVID-19 vaccine, there are questions about if your employer could require you to get it. The clues from past flu shot mandates. Surprise, COVID-19 related medical bills continue to be a problem. Why experts say this potentially affects everyone, regardless of whether you get a bill. And a growing number of doctors think voting could be the answer to helping with some of the problems they see every day. How doctors nationwide are now getting more people registered to vote.
First at 5:30, the city's housing agency is possibly spared from losing one of its prime buildings to foreclosure. WRTV Investigates has learned that the agency, which provides housing for the most vulnerable in the city, will now have until December to pay off a multi-million-dollar loan that was due tomorrow. WRTV's Rafael Sanchez reports on property and the people at stake.
The Milliken on Mass Ave sits in the heart of the trendy shopping and dining district near downtown Indianapolis. The project, started in 2014, is made up of two sections. Milliken 1 is for low-income housing. Milliken 2, on the same property, charges regular rent and houses several businesses on the street level. Both are managed by the Indianapolis Housing Agency. IHA will lose Milliken 2 if it does not pay an $8.5 million loan. John Hall runs IHA.
This particular action is trying to destabilize this project. I think it's very unfortunate that we're in this predicament. I think, especially during a pandemic, it's unreasonable for us to not have an extension on our loan.
The construction loan is owed to Merchants Bank of Indiana. IHA thought it had worked out a 6-month extension to pay back that loan. Instead, it got this letter demanding payment, but willing to consider an extension if and only if a change in leadership acceptable to merchants occurs within Insight Development.
Can you do that? Is that legal? Can you legally tell a public official that if you get out the way, we may give you an extension on a loan? Is that legal?
It doesn't seem to align with the Indiana code of intimidating and coercing a public servant.
Insight Development is the not-for-profit arm of IHA. Insight has been the target of WRTV Investigates for supporting programs not in line with the needs of people who need housing. Insight was run by Jennifer Green at the time of the loan. When the top job at IHA was available, the mayor decided to hire John Hall instead. Hall also took over leadership of Insight to make some changes.
You're not buckling under the pressure because you could have easily have said, okay, I'll quit, I want the money. You're not doing that.
Absolutely not. As a leader of the agency, this is just adversity that is not insurmountable. It's something that I will overcome.
Before airing this story, Rafael provided the lawyer for Merchants Bank the contents of John Hall's comments. WRTV received a no comment from the lawyer. So here are some more details. On Saturday, IHA received word of potential loans to pay off merchants. Those loans were reviewed today, but no announcement will be made until September 8th. The city of Indianapolis has also offered $1.5 million to help out IHA. Kevin.
Well, maybe a couple of showers this evening. I think they're few and far between. This is really a vision test as you look at our radar. Southwest side of Marion County, right along I-70 and 465, maybe a few sprinkles there. Then you go out 36 into Hendricks County, a couple of sprinkles. The cloud cover, it's thick, as you could see, as you looked from the Motor Speedway to downtown. And then the areas that I was mentioning as far as any showers or sprinkles should not be widespread. And as we take a larger view, we'll have to wait. We've waited a lot this month for rainfall. Won't really happen until tomorrow afternoon on any widespread basis. Temperature in Columbus is one of the coolest. They are in the 70s. Otherwise, you're looking at temperatures in the lower 80s with more humidity than we had yesterday. 67 tonight, Patchy fog again could be locally dense in spots as we get past midnight into tomorrow morning. During the morning hours tomorrow, 76 by 11. There are your scattered thunderstorms that develop during the afternoon hours with temperatures back into the lower 80s once again. We'll talk about other rain opportunities as we move forward coming up.
The president is planning on visiting Kenosha, Wisconsin tomorrow. The governor of Wisconsin wrote the president a letter urging him to reconsider as protests continue. Governor Tony Evers says he's concerned the president's visit will hinder the city's healing. President Trump plans to meet with law enforcement and take a look at damage from recent protests. Oregon State Police are back in Portland to help local police. President Trump supporters and counter-protesters have been clashing following demonstrations. Portland's mayor is blaming the president for the rise in violence in the city and says both he and the president need to be held accountable. The world is still reeling from the sudden death of Black Panther star Chadwick Boseman, the man who gave us a black superhero dying from a disease he kept quiet about, colon cancer, at the age of 43.
No one really likes to talk about having to do the prep or, sticking something where the sun don't shine. So, I hate to say it, it's, very awful and very sad, Chadwick's passing, but, hopefully this will bring much needed attention, not only for people in Black and brown communities that are higher risk of both getting the disease and dying from it, but also young onset and just people in general, even over the recommended age of 45 for getting screened.
The head of the Colorectal Cancer Alliance, who also lost his mom to the disease, is addressing the stigma, highlighting the fact that African Americans are at higher risk of both contracting and dying from colorectal cancer. People of color are also more likely to develop colorectal cancer at a younger age and to be at a more advanced stage when diagnosed. This is likely due to a combination of factors, including healthcare inequities. Young onset colorectal cancer is on the rise, about 2% every year. Experts aren't sure why. Misdiagnosis is a common issue.
If you have night sweats, if you have cramping, if you have bloating, if you have fatigue or unintended weight loss, change in bowel habits, certainly bleeding, dark colored stools, etc., you have to see your primary care physician.
A traditional colonoscopy isn't the only screening method. There is a less invasive virtual colonoscopy that uses CT scanning. Also, a stool sample test, even at home screening, called Cologuard. You can check out getscreened.org for more information. Still ahead in our lineup, can your employer force you to get a COVID-19 vaccine? We're getting answers from a legal expert. The FDA could authorize emergency use of a COVID-19 vaccine before phase 3 trials are over. Commissioner Dr. Stephen Hahn says the agency would have to determine if the benefits outweigh the risks. He adds that the vaccine decision would be based on data, not politics. Some experts are calling for an independent commission separate from the FDA to review COVID-19 vaccines. That's because of increasing distrust of vaccines and criticism of government agencies. Prominent physicians hope the added layer of review could give Americans more confidence the shot is safe and effective. Right now, approval from the FDA is all that's needed to be put on the market. Employers may be able to require a COVID vaccine once one is available. An employment attorney we spoke to says there's no definitive answer yet, but based on flu shot mandates in the past, it's possible with some exceptions.
So it's not a blank check. It's not something that can just be done across the board, but it is something that can be done.
Some reasons to be exempt could be a medical condition that would somehow make the vaccine harmful to the employee or a sincerely held religious belief. For those workers, employers would need to make some sort of accommodation that could require wearing a mask or continuing to work remotely, even a reassignment to another job function. No matter the accommodation, it needs to be reasonably based on the risks for the industry.
It all depends upon this particular needs of the employer, how much interface there is with other employees, how closely they work, how much interface there is with other people, whether it's customers, patients, students, whoever it may be. So it's an individualized process. There's no one-size-fits-all solution.
Employers offering those accommodations and explaining their reasons for the mandate could help prevent legal pushback. State law can also impact how much control employers have in requiring vaccines. More in our lineup. Americans are still dealing with surprise COVID-related medical bills. Why experts say this potentially affects everyone, even if you aren't the one getting a bill. An online service that matches freelance 3D modeling designers with project needs is now tackling classroom safety. CADcrowd.com hosted a design challenge to come up with ideas to protect students from COVID spread. People presented 3D printable projects and other designs. Various desk shield ideas took the top 3 spots. The goal is to present ideas that anyone can affordably make with 3D components or other materials. The decision about when and how to go safely back to school is not uniform across the country. Many states are using what's called the positivity rate, which is a percentage of positive tests in a given week, as their barometer. The CDC recommends not going back to school if the percentage is higher than 5, but as Dan Grossman shows us, some states have their own rules.
Prior to COVID, Daniel Kenyon had hoped his sweat equity would lead to a spot on his middle school basketball team.
He has a goal to make the A team, and he's, really been focused on it.
As it stands now, that's no guarantee, as his school district in Iowa City, Iowa, has now taken to a court of a different kind.
It was a 7-0 vote, and it's the Iowa State Education Association, the State Teachers Association, that had spearheaded the litigation, and then we unanimously voted to join them.
Once word came down in July that the governor would require schools teach at least 50% of its curriculum in person, the Iowa City School Board joined in on a lawsuit challenging her power to require it.
I look at my husband, who has to go teach in high school, and look at the risks that presents to him. I have to look at my kids who are missing out on in-person school.
The governor's mandate conflicted with CDC guidelines. Along with the 50% rule, the governor created a 15% rule that said classes could only go online only if that positivity rate went above 15%.
It's troubling.
The whole issue created a conundrum for first-year school board director Lisa Williams.
I think kids need to be in school. They need to be for a whole host of reasons. But I don't think that the 15% is a good barometer of whether or not it's safe to do so.
Iowa's positivity rate threshold of 15% is one of the highest in the country. The CDC recommends 5%. New York has said its kids can't go back to school unless the positivity rate is under 3%. And Arizona has set its bar at 7%. Even the Surgeon General has said schools nationwide shouldn't consider it unless the positivity rate is under 10% to prove the number of cases is shrinking.
I was shocked and I was angry. I'm still angry. I have a lot of anger.
It's why Mary Kenyon has decided to keep Daniel home for the school year unless things change.
They're trying to create a policy that will blanket a state that has widely varying types of educational settings.
The issue isn't exclusive to Iowa either, but most rural states. Iowa City School District has 14,000 students. Compare that to some of its rural counties that only have a few hundred, and 15% means something entirely different, she says. Different for students who just want a shot at some normalcy.
I think we all want what's best for our kids, and not everybody agrees on what that looks like.
In Iowa City, Iowa, I'm Dan Grossman reporting.
And the parent company of WRTV, EW Scripps, is asking for your help to raise money to ensure kids in low-income households have access to books and empower them with the gift of literacy. It's called If You Give a Child a Book campaign. It's an annual drive led by the Scripps Howard Foundation and Scripps employees and family members. Over the last 4 years, the campaign has donated more than 352,000 new books in communities served by Scripps businesses. Now, for the first time, we are opening up the effort to all of you and asking you to donate to the cause. Donations will be accepted through Friday, September 11th. To donate, just go to WRTV.com/giveabook. You can find more info in this story at WRTV.com. Kevin.
There's nothing like the smell of a new book and opening that up for the first time. I remember Charlotte's Web was one of my favorites as a kid, and then Benji in paperback. Awesome memories. All right, the clouds look heavy, whether it's in Monroe County, Marion County, or where you are across central Indiana. They may produce a couple of showers, but we're not expecting any widespread rain. Southwest side of Marion County, then on down toward Mooresville along Interstate 70. Couple of showers there. As I broaden the view, I'm doing this just to keep track, make sure nothing sneaks up on us. Looks like down in Greene County, south of Bloomfield, could be a couple of sprinkles. That's what I mean by heavy, the dark cloud cover just hanging there, 80 degrees or within a degree of that with a light wind, humidity higher, and our chance for fog goes up tonight. Temperatures will be in the 60s overnight tonight. Keep in mind, we'll be in the low 50s at times for the 7-day forecast as we get into Labor Day weekend. Saturday morning specifically will be one of the coolest mornings in the forecast. Looking ahead, tomorrow, plan on 83. Thunderstorm chances develop and increase in the afternoon into the evening hours. A couple of those could be strong. 83 with scattered thunderstorms in the middle of the week on Wednesday. A little bit lower rain chance. Temperature comes down a bit on the Thursday, as you can see. There's the story of the humidity. Humidity is up there again compared to yesterday, but look what happens. Perfect timing. End of the work week into the Labor Day weekend. Humidity goes way down. Temperatures will follow. That means comfort is on the way.
Amazon has gotten the okay to use drones. It's a milestone approval from the FAA. Amazon says it's now going to start testing customer deliveries in a move toward one day operating its fleet of Prime Air drones. United is dropping its $200 ticket change fee on domestic flights. The move will put pressure on other airlines to drop theirs too. United is also extending a broad waiver of change fees that includes international travel through the end of the year. People who are supposed to have their COVID tests covered by insurance are continuing to get hit with massive bills. Healthcare advocates are calling on Congress to address the problem. Chris Conti introduces us to one woman who's warning others.
Walking into the emergency room, Lori Delgado Witten knew the COVID test she was there for would be far from pleasant.
It was, the swab up into your brain, basically.
But the pain of that quick swab has lasted far beyond the 2-minute test she received recently.
It's just not knowing what it's going to, every day something changes.
Lori got her COVID test at an ER near Houston on May 18th. 10 days later, on May 28th, she finally got her results. They were negative.
Nobody called me. I actually had to call the hospital and find out how to get the results.
It wasn't just the wait for the test, though, that Lori is concerned about. It's the bill she received in the mail days later she still can't comprehend. The total, $3,165.92. More than $3,000 just to get one COVID test.
Yeah, I think it's a total scam. And, in the midst of a pandemic, it's even worse.
Under the CARES Act passed by Congress, COVID tests are legally mandated to be covered. Because Lori had already met her deductible, she personally didn't owe any money. But it's the principal of her insurance company agreeing to pay that astronomical bill that causes her deep concern.
In the long run, any costs that insurance companies are taking on as a result of COVID, they're going to be passed on to you. They're going to be passed on to me.
This is a real problem.
Michelle Johnson is a healthcare advocate. She's worried that stories like Lori's will deter others from getting tested.
If people understand that it's going to cost money to go get a test, they won't do it.
People from New York to Texas to Tennessee to Washington State, all reportedly receiving surprise COVID bills. What can you do if you visit the doctor and get a surprise COVID bill? Aside from contacting your insurance company, Michelle Johnson says call your elected officials. Let them know what's happening.
The only solution is for elected officials to step up and do their job.
Some kind of accountability so that Americans aren't suffering any more than they already have.
It's bad enough to do this, when things are normal, but in this kind of environment, it's sickening.
I'm Chris Conti reporting.
Finally in our lineup, a growing number of doctors think voting could be the answer to helping with some of the problems that they see in the ER every day. How doctors are now getting more people registered to vote. Groups working to get people registered to vote are having to get creative during the pandemic. The typical places registration happens, like in-person tabling or at the DMV, may not be an option. Doctors across the country are now stepping in to fill the gap. They're getting their patients registered to vote or getting them their mail-in ballot.
We don't have time to be convincing people. We do have time to remind them and to make it easy for them.
ER Dr. Alistair Martin says that he started Vote ER first because of his own experience growing up in a majority minority community in New Jersey. He saw there the impact that the ER can have in communities with people not having a primary care doctor or insurance. He also started the voting effort after experiencing things with his patients in the ER, like a woman who lost her job and had to make a decision between paying for her dad's prescription or getting food herself.
I can't solve any of those problems with a medication or a prescription. I can't solve any of those problems with a surgery, but she can solve that problem by voting. We can solve that problem by voting.
20,000 doctors across the country now have one of these badges or will be getting it soon. There's a number the patient can text or a QR code they can use to register themselves. Dr. Martin believes both the killing of George Floyd and COVID-19 have gotten more people engaged.
So I think that has really led to this incredible confluence of both patients and providers realizing that the idea of civic engagement is clearly related to healthcare. And COVID made that connection clearer than I think anything else could have.
So far, Vote ER has helped more than 10,000 people get registered to vote for November or get their mail-in ballot. COVID-19 is making some people rethink staying in group facilities for addiction treatment. Tomorrow, the controversy of providing hotel rooms for those in recovery, why some say it's a lifesaver and others worry it'll negatively affect their neighborhoods.
You may catch a spotty shower this evening, but your best chance for any widespread showers and thunderstorms will come during the day tomorrow. Our temperatures will make it into the lower 80s tomorrow afternoon, with thunderstorms becoming more likely. That's all for the news at 5:30. More news starts right now.